Dr. Christopher Rogers is a cardiologist from Bronson Advanced Cardiac Healthcare in Kalamazoo. Dr. Rogers, welcome. Let me ask you this. What is your role as a cardiologist?
My role as a cardiologist is to evaluate patients from the standpoint of structural heart disease, which means muscular function, how well a heart functions as a pump, valvular disease, making sure that all the valves have blood flow that goes in the correct direction and not in the wrong direction, that there's no impedance in flow or blood flow, and that the arteries are open and can supply adequate the heart with adequate nutrition so that the heart can do its job, and that they have reduced risk of heart attack, which can injure your heart and then lead to subsequent problems. And then in addition to that, rhythm management issues, so to make sure that you maintain a normal rhythm, and if you don't, then work to re-achieve or reestablish normal rhythm.
Dr. Rogers, we've heard, obviously, that heart disease is one of the major causes of disability and death in the United States. Can you tell us some of the ways that you can test your level or find out your level for heart disease?
Yeah, well, the simplest things are knowing what your cholesterol status is, what your good cholesterol is, your bad cholesterol is, your HDL, which is the good, the LDL cholesterol is your bad cholesterol. You want your good cholesterol as high as possible, your bad cholesterol as low as possible, and then working with your clinician or your primary care doctor to try to optimize those levels as much as possible. Working hard to maintain an ideal body weight. Diet and exercise are always very important. Maintaining diet and exercise helps to reduce your risk of hypertension, which is a risk factor. Also reduces your risk of diabetes by helping to achieve a good or a more ideal body weight, reducing your risk of type 2 diabetes, which is an additional risk factor. Avoiding smoke or tobacco or nicotine products is another important thing to do, because that increases your risk. There are things we can avoid. We can't avoid being males, which gives you an increased risk of earlier heart disease. But I think now in industrialized countries, the risk for females is pretty much on par with males, or just the incidence of heart disease just seems to occur later in females than it does in males. And we also can't take away our genes, and there's not a true one gene that causes blocked arteries. But family history with people who have heart disease at an early age clearly puts you at risk. So trying to manage the things that you can manage is the most prudent things that you can do.
We're talking with Dr. Christopher Rogers. He's a cardiologist from Bronson Advanced Cardiac Healthcare in Kalamazoo. One of the things that I have noticed, Dr. Rogers, is they're making a major effort to let people know that heart disease presents itself differently in men versus women. Can you tell us a little bit about that?
Symptoms for women tend to be more atypical than they do for men. Instead of having the elephant sitting on your chest when you're trying to do any physical activity, or the ton of bricks, which gives you the centralized chest discomfort, which goes up into your neck or down into your arm, which most people are very good at picking up on. Things may be much more subtle for women. It may be progressive fatigue with activity, exercise intolerance that they just can't explain, undue shortness of breath with activity that is new or changed for them, and so symptoms can be quite vague for women compared to men. But in general, it's completely an individualized thing. How your body is hardwired, so to say, to experience symptoms of lack of blood flow to your heart is quite varied among all people.
So it sounds to me like what people need to do is, like you were talking about earlier, the risk factors. You combine that with staying in regular contact with your primary physician, and that would give you a better handle on making sure that you keep ahead of the curve, so to speak.
Exactly. And the other thing that I encourage all of my patients, and especially my patients who I know have had heart attacks or blocked arteries in the past, is if they maintain a good level of exercise, and they exercise on a routine basis, every day that they exercise, they feel great, they're doing great, is every day that they can think to themselves, I don't need that Dr. Rogers guy anymore, or I don't need him right now. And if they start noticing a change in their exercise tolerance, then that's something that should alert them to say, maybe I better contact him and get back in to see him, or get back in to see my primary care doctor. Heart attacks are, in general, hard to predict. The best predictors of heart attacks are when people start having fairly rapid changes in their functional capacity. They just can't do the things they want to do, or they're having worsening symptoms of chest discomfort, and they ignore those things. Those people are heart attacks waiting to happen. Short of that, everybody's heard about the person who's a marathon runner or runs, 5 or 10 Ks on a regular basis, exercises regularly, and boom, all of a sudden, out of the blue, has a heart attack. There are certain features of coronary disease that are unpredictable. Then, unfortunately, that's the most dramatic thing that people hear about.
And it sounds to me like the education is the best thing. Be ahead of the curve. Go to the Bronson website, get as much information, and again, make sure you've got a dialogue going with your primary care physician so that you're asking the right questions.
Absolutely. The thing that I tell everybody, and unfortunately the people that I see, it's usually too late for, but I tell all the people that I see, the best therapeutic option for cardiovascular disease, especially ischemic heart disease or blocked arteries and heart attacks, is not to have it. Once you have it, we do the best we can with medical therapy, balloon stents, bypass surgery, and all of the things that we can do to fix it. But if you're really looking at the best way to manage heart disease, it's to prevent it.
Sounds like good advice to me. Dr. Christopher Rogers, he is a cardiologist from Bronson Advanced Cardiac Healthcare. Dr. Rogers, thank you so much for taking time out of your busy day to talk about a very, very important subject, and we'll look forward to talking with you again soon.
Thank you very much, Jim.